This is Dental All Stars, where we bring you the best in dentistry on marketing, management, and training.
Hi everyone, I'm Alex Nottingham, CEO of All Star Dental Academy, and welcome to Dental All Stars. Our topic is Discover the Patient's Why in Dental Treatment Acceptance. Our guest is Eric Vickery. Eric is the president of coaching at All Star Dental Academy. He speaks all over North America on practice management and case acceptance. Since 2001, Eric has coached over 300 offices on all areas of practice management topics, including how to resign from restrictive insurance plans. Please welcome Eric.
Hey, Alex. Thanks for having me again.
Well, good to have you back. And we are continuing our discussion on case acceptance. We talked about case acceptance last time.
Yes, love it.
The 95-5.
Yeah, last time was good. 95-5 rule.
The why. So why do you think patients don't move forward with treatment and then subsequently they cancel their appointments?
Yeah, I think the analogy is, and I'll talk to clients, their admin team members about this, and they'll have this feeling in their stomach. This patient's in front of them. Yeah. Oh yeah. Yeah. I'll do that. Yeah. Oh, $5,000. Yeah. I'll pay you when I get here that day. Yeah. Mm-hmm. Yeah. We call them the yesers. They just say yes to everything and they never ask how much. They don't have any hesitation at all. And I'll ask the admin team members about this. So you see this patient walking out the door and in your mind, you're thinking, I'm never going to see that patient again, am I? They just want to get out of there. There's no connection to it. And so not only do we want to get patients healthy, but we want to get them healthier faster. We don't really want to do one tooth at a time and take years and years and years to try to get them healthy. It's going to create more problems. So how do we get, whether it's quadrant, side of mouth, arch, full mouth dentistry completed in as short amount of time as possible? And you're right. Continuing from last conversation where we talked about the 95-5 rule, is the first thing is I think people cancel because they don't really truly understand the problem. Therefore, there's no urgency. And so we focused on that last time. 95-5 rule, focus on the condition and the consequences, not so much on the treatment. Avoid things like you need a crown, you need 4 quads of scaling. And the second reason I think that people avoid or step aside, cancel, just flat out don't schedule, say I'm going to go home and think about it, is they're not really connected to the plan from an emotional state. You and I know that people buy with emotion, justify with logic. We say this all the time. And what I'm saying is that reason that they buy emotionally can be discovered. And I call that finding the why. And so we just take a conversation before we ever look clinically and just really sit and talk with the patient and find out not only what they want, but why they want that. And so when you can connect to that patient on an emotional level, you're building trust and rapport. When you discover their why, now they're not just being told what to do, they're actually connecting to it from an emotional reason.
So what would be an example of a why that we're looking to discover?
So I'll tell you my example of a why. So if you were to go through this conversation with me, what you'd find out is I want to look good and feel good. Most people, pretty simple. I want to keep my teeth. I want to look nice. I don't want them all over the place. Most people fall in that category. And so the mistake would be to stop there and say, all right, we know Eric wants to look good and feel good. Done. Well, that's a what, not a why. If you were to ask me, why is having that important to you, Eric? What you would hear me tell you is about my grandfather. My grandpa Bill, he had dentures. At least I know he had an upper denture because he would stick his tongue up in the roof of his mouth, unlock his denture, and then rattle his teeth at the 4-year-old version of me, 5-year-old, 6-year-old. That was how he would greet me. It was terrifying. And then I would see his denture and maybe his backup denture or something in a glass on his nightstand. And I just, as a kid, thought, whoa, that is scary. And so for me, I never want to lose a tooth. In any tooth, I don't want to lose any of my teeth. People have nightmares about, going to class with, without pants on and stuff. I have nightmares about breaking teeth or losing teeth. I don't know why, if I'm the only one that does that or not, but you would find, okay, Eric, you now have a why. You now know why it's important for me to look good and feel good. There's an emotional reason attached to that behind. And it's peace of mind, right? And there's a story attached to it. When let's say you're Dr. Nottingham, right? And you're doing the exam and you find any sort of recession, you find any sort of bleeding in my gums, you find large fractures or anything you diagnose that I was unaware of when I walked in the door, you get to connect those two things together and say, hey, Grandpa Bill versus where you are now, it's preventable. And now there's an emotional tie to what you're discovering in the 95-5 role. So now you have condition logic, right? Here's the condition, what's going on. And now you have emotional reasoning for me to say, oh, that's important for me to buy. And I think the problem with most of us is we grew up in the because I said so world. I don't know if your parents said that to you, Alex, but my parents would often say, because I said so. Because I would say, why? Why is this important for me to do? Why do I got to clean my room? Because I said so. And when you don't know that why for your patients, you're falling in that same category, because that patient's thinking, why do I really want to do this? Why is this important for me to do? And because you don't have a connection as the dentist, the practice, you're saying, because I said so. And that's where we don't want to live. Make sense?
That makes sense.
Yeah.
So, like you said, we get the logical part. We have to discover the why, the emotional part.
Yes.
For that patient. And
yes.
So you gave me an example of a why for you to keep your teeth healthy. And then what do we do with those whys when we are discovering it? Or are there questions that we can utilize, or how do we discover it?
Yeah. So the preclinical conversation, before you ever look in their mouth, you would just introduce it to the patient. If you're my patient, I say, Alex, I want to take a few minutes and not only get to know you, but know what it is you want for the health and appearance of your smile. Because that way we're on the same page. I'm not telling you what I think is important. You're gonna tell me first, and then we're gonna give you exactly what you're looking for. So I want to ask you a few important questions before we get started, so that we're on the same page. Does that sound okay to you?
It does. So I see what you're doing. Yeah. You're basically setting up your conversation.
That's
to,
right.
like you say, discover the why. It's not just because typically as practitioners, dentists are looking for the clinical issue and then providing a clinical diagnosis, and here's what you're looking to do.
That's
But
right.
you're looking to diagnose the entire person, their brain. You're a neurosurgeon in a sense, or a psychologist in reality.
It's the psychology of it, exactly.
Right. You're looking to understand what motivates them, because that's why they're looking to get fixed. And it's the external is looking to help them with the internal. I see what you're saying. So this is a little bit, not a little bit, but this is a much more nuanced approach to case acceptance, and requires a subsequent or required skills to be able to do that.
Yeah. A lot of team members hold back in regards to this conversation because they I don't know, they're worried, they're not confident, they're approval addicted, whatever it is. This is the practice that we see when we do KPIs. We look at our case acceptance tracker. We see a practice that goes from a lot of single tooth dentistry, maybe one or two teeth, to someone who now goes to getting the whole mouth healthy in as quick a time possible. And the reason for that is the connection that I'm making with you as the patient. Trust is up. Doesn't feel like I'm selling you. That sell word in dentistry is a real challenge. And I now know why you want what you said you wanted, instead of me just telling you what you need. So I go from adding 95.5 plus the why, put those two things together, and now you've got something.
It's interesting you mentioned the word selling, because at All Star Dental Academy, we're not fans per se of the word selling.
Yeah.
And I think over the last few years, where we can have conversations about it, because selling has become a bad word in dentistry for a lot of reasons. It's not bad in reality. And so let's have a discussion about selling. Maybe we can use a different word for it. If we do use the word selling, how do we connote it properly? And so again, these are trigger words. You hear selling, go, oh no, what is that? And how do you define it?
Sure. So at our May event, when we talk about this, we'll be saying, all right, who got into dentistry because they love selling? Nobody will raise their hand. But yet at the same time, we recognize there are no professions that exist without sales. Even the pharmacist has to sell the pill at the end of the day. Even the artist has to sell the artwork at the end of the day, because it's just part of life. It doesn't exist any other way. Maybe it should. I'm not going to get into that, but this is where we're at. And so what we have to understand is there's two types of purchases that people make. Learned this years ago: push purchase or pull purchase. A push purchase is something that you're told you need to do. Life thrusts it upon you. It's, I need new tires. I need to go to the grocery store. I need to pay my bills. I need a new hot water heater. I need a new AC unit, whatever it is. Need. And life thrusts it on you. We typically don't like spending money in these categories. It's not something that we choose to do. We're not excited about that. We don't want to. The other side is the pull purchase. That's synonymous with want. I want to go on vacation. I want to go out to eat. I want to go to the movies. I want to go to the fish store, Alex. I want to go golfing. I know, right? It's a weird hobby.
Fish and golfing.
Fish and golfing. They don't really.
They
don't
have
really
some
go hand in
ponds
hand.
there. You could basically take a break on the 18th or 15th hole and go get your
Usually I'm
fishing
not
rod
looking
out.
I'm not really looking for fish in the water. Typically, I'm looking for my golf ball. So
there you go.
Yeah. So I should put some golf balls in my fish tank. That's what I should do.
There exactly.
I came up with the mastermind. Look at that. So what we have to understand is most people don't wake up in the morning and say, what should I do today? You know what? You know what I really want to do today? I want to go see my dentist and get a crown done. I want a crown today. In fact, most patients sit down in the dental chair when the doctor walks in for the exam and they look up the doctor and say, don't find anything today, doc. Nothing to see here. Just move along. And they're just hoping, praying this doctor doesn't tell them they need to do something, push purchasing being thrust upon them. And so if you recognize that the patient is trepidatious about sales, it reflects on us. So people in dentistry go, oh, I hate selling. I don't want to be selling. Alex, you and I have always joked about this. I'm not a salesman. I know I'm not a salesperson. And I think I'm okay with that to an extent. I know that at some point I've got to make a sale. I get that. Just like every dental team member has to say, at some point, I've got to make a sale. And I'll side note this: nobody ever wants to talk money until it's time to talk about a raise. And so I would just throw that out there and say, hey, I'm okay talking about a raise as long as you're okay talking about how do we get the patient healthy.
Here's the thing. I like to build on this a little bit with the sales stuff, because I think that there is things that we can learn from sales training, right? In general, especially if there's ethics behind it. And when you're in retail, it's selling, it's obvious. I think when it comes to the dental experience, as you're talking about, becoming that practical psychologist, learning to get to their why, because if you're not doing that, this is very interesting. If you're not doing what Eric's talking about, you really are a salesperson, because they're coming in your diagnosis and you're selling them something. How is it different going to a dentist than it is going to a mechanic? Diagnosis, and then boom, here's what you got to do. And isn't it interesting whenever you go to the mechanic, you're like, oh, they're going to recommend something I don't need. With dentistry, it's more like you're a problem solver. You're here to help them. And if you build rapport, which is a big thing that we teach in our programs and in our live events, if you focus on in terms of building rapport, getting to know them, you become the logical choice. So by getting to know their needs, they're going to choose you. They're going to want to buy. So you become that. You don't have to pressurize.
That's
you don't have to do pressure sales. So we can we can mince words and figure it out. You can call it whatever you like, but it really becomes down to, are you building rapport with that patient? Are you getting to understand them, their heart, their soul? And then if you're coming from that place of I care about them, because first of all, getting to know them and finding their why is demonstrating you care about them. And when you care, they feel straight and they feel that you can solve their issue. You are obligated. You are ethically, emotionally, everything obligated to provide them the services. And that's where you come from. I am obligated to take great care of them. And that's what motivates me, no matter what you look to call it. And if you don't sell, or if you don't provide them the solution, you are acting in their disinterest.
That's right. That's right. And a couple key words: pressure sales, motivation. I come from a school of thought of you can't really motivate someone else. Come on, Alex, you can do it. Cheer you on. But I can find out what motivates you. I can discover what you're motivated by, and that's where the why comes from. Whether it's Simon Sinek, Start With Why, it's been around for a long time. And we just have to make sure that we're comfortable in our own skin, that we're confident, we're not having this fear of rejection in our conversation, that we carry ourselves confidently to have this conversation. And then we use it to help them be motivated. The second thing you said is pressure sales. And that's what goes back to need or push purchase. You need a crown. We'll see this in May. Hey, raise your hand if you love sales. Okay, nobody raises their hand. How many of you don't like pressure sales? Everybody raises their hand. And then I say, all right, raise your hand if you've ever said you need a crown. And everybody raises their hand. You need 4 quads of scaling and route planning. Everybody raises their hand. That person does not like to be told what they need to do. Think about when you're 15, 16, 17, 18 years old and your parents say, you need to clean your room, you need to take out the trash, you need to do your homework. The rebellion occurs. Just happens. And so if we're telling patients they need a crown, they need the 5%, they need treatment, they're going to oppose that almost instinctively. So instead, you focus in on the condition. Here's the problem. You said you don't want to end up this way. Look at how those two things conflict. What do you want to do about it? And now we get in a solution. So if people don't like to be told what they need to do, pressure sales, then we have to get away from this need word, this telling people what they need. It is a clinical need. It is a must. It is your recommendation if they want to keep their teeth. And you can make that point really come across emphatically if you use the right verbiage. So they buy for their reasons, not your reasons. That's the bottom line.
You talked earlier about, and I asked you this, and we can kind of maybe go a little more in depth, is how do patients find their why, or how do we help patients find their why? You talked about the preclinical conversation. Do you care to expound on this a little bit?
Yeah, I think this is the big difference between basic case acceptance and large case acceptance. With clients who are struggling with this, we start with the 95-5. If we could just get that under our belt and get away from need and get focused on condition and diagnosis and consequences, that's a win.
Well, and by the way, just to make a note for the listener, 95-5, that was a prior podcast we did. We'll link to that as well. You can find that on the various platforms that we provide to access that. As well as you're mentioning May 19th and 20th, we have a live event in South Florida where we go into great detail about case acceptance. I'll mention that at the end of the podcast. Go ahead, Eric.
Yeah. So we use how do we find the patient's why? We use a preclinical conversation. Could be team member, treatment coordinator, assistant, hygienist, could be doctor. As an administrator of a practice, business manager of the practice, I would love when they were running behind out back when they couldn't see Ricky Bobby, the new patient, on time, because I would take Ricky Bobby in the consult room and I'd sit down and I would do this preclinical conversation. And it seemed natural that we would have this conversation if you do it correctly. And if you're unnatural at it, it will be unnatural. So this is where practice comes into play. I was on site doing a practice evaluation with a client, longtime client, and we'll say Dr. Paul, in case he listens, and I give a shout out to him. He's now retired, which is great. But I was standing in the hallway listening to him to get ready to do this, and he says, "So, Ricky Bobby, I've got some really weird questions to ask you. Just bear with me, and we'll get through this together." And how do you think the conversation went? It went weird and awkward, and we barely got through it. And so, as we pointed out earlier, the setup for that conversation makes all the difference. So I would sit down with the patient, anybody can do it, and say, Ricky Bobby, before we look in your mouth, we just want to know what you're looking for and what's important to you so that we have a good understanding on how to best take care of you. And the only way to do that is just through a conversation, ask you some really important questions. The more information you give me, the better job we're going to take care of you. How does that sound? And they go, yeah, sure. And, we're in rapport building body language and we're in conversation, and we have a series of questions that we go through to analyze this, that we teach, and we get to the question, why is having that so important to you? And that's where you hear confidence, peace of mind. I'm looking for a job interview. One of the largest cases we sold in our practice was an MBNA executive who kept getting overlooked for positions. And he felt like we did this preclinical conversation. He was an existing patient though. And we did it via email. He went home thinking about it. Our hygienist, Debbie, got him in this conversation with a mirror. He sent back a thing and said, I've been taking care of my kids. I never smile at work. And people think I'm a grumpy person. I think I'm not getting promoted because of that. And we closed everything for the whole front mouth via email. there's that word closed. We got his commitment through that, right?
Better.
That's a better word, I think. Got his commitment to move forward with that just by having a conversation via email and going through this. And we got to, why is having this so important to you? And he said, I'm not getting promoted because I don't smile at work. I know it. And so his why finally came out after he had known the dentist in high school. That's how long he'd been a patient. So if you do this, you're going to find real reasons, real motivating factors, real emotional reasons behind why they want what they said they wanted.
Makes sense. Now, you mentioned large case acceptance.
Yeah.
Tell me more about that.
Well, again, I think there's phases to this, like we talked about before. Just getting patients to say yes and committing to it, not canceling it, means they have to understand. First thing is, people aren't going to buy your treatment plan if they don't first buy into the condition, the diagnosis. So that's co-diagnosis. And there's a saying, before you can prescribe, you must first diagnose. That's on our end. On the patient's end, they're thinking, well, before I'm going to buy what you're telling me, doc, I got to first understand why. Like you said, the mechanic. Oh, they're going to try to sell me something. And we know this happens because they walk out to the front desk and say, oh, doctor must need a new car, or got to put doctor's kids through college, or whatever. Whatever the perception is, we sold them something. That's not where we want to live. We want to live in mutual agreement. We want to live in a place where they feel like they're getting good advice from somebody they trust, and they want to do it themselves. They're motivated themselves to do it because they have all of the information. Now, second part is, people buy with emotion, justify with logic. What's that emotional reason? People buy for emotional reasons, not your reasons. So if you're telling me what I need to do, now it's your reasoning because I said so. So large case acceptance is like this. You ever notice, especially, I think, I don't know. This is me, Alex. I can't speak for you. But if I want something, I'm going to figure out a way to save the money. I'm going to figure out a way to spend the money on that. And I'm going to be very excited to do this. It's a big deal for me. When we do large case acceptance, these patients love it. They love, now that they can eat. I mean, if you go on YouTube and just search dental patient biting into an apple, you're going to get just a series of videos on YouTube of patients for the first time biting into an apple because they have implants. And the motion that's suggesting, it's not selling dentures. It's selling quality of life. It's selling, here, you get something that really means something to you. So we get away from, a crown a year club, and we start doing what people really, really want. And with the level of clinicians that we have, it's a disservice to dentistry for us to be holding back. Like you said earlier, we almost have an obligation to make sure we take care of these patients at a full mouth level.
Eric, tell me about the live event in May, because a lot of it's going to be case acceptance. You're so excited. You're emceeing. You're the keynote. We got a lot of great speakers as well. Tell us a little bit about that. That's the 19th and 20th, correct?
Yes, May 19th and 20th, Friday, Saturday. Beautiful Florida, and beautiful place that we're going to be, and inviting the whole team. So all teams, entire team concept on how to get the patient to really move forward and keep the appointment, and not just for single tooth, but for as much dentistry as it makes sense to be doing. And so we go from understanding ourselves and what's preventing us from doing these things, right? To get something you've never had before, you got to be willing to do something you've never done before. And so what is going on there in the individual? We work on the team through DISC personality profile system. And then we take you through great call process, because case acceptance plays a role in the phone call. How well you answer the phone reflects how good of a dentist this is. Are you building trust and rapport on the phone, or are you making it really difficult for a patient to want to come in and see this dentist? Then we take it through patient shows up, how you do the preclinical conversation, how you do the clinical conversation. So we go from finding the why to the 95-5 rule. Then we go into case presentation formula, how to handle when a patient says no at that point. How do you interact with the patient once they start throwing out things like, well, is my insurance going to cover this? I can't afford it. All those things. We cover all that. And then we're going to also talk about how to cancel the cancellations. So it's a power pack 2 days. It's like drinking from a fire hydrant for sure.
Well, please, everybody listening, remember to subscribe on YouTube and follow us on Apple Podcasts and Spotify. Thank you, Eric, as always, for being on our podcast. And until next time, go out there and be
an all-star.
We hope you enjoyed this episode of Dental All Stars. Visit us online at allstardentalacademy.com.